Can you have normal body weight and be actually an athlete and still have lipedema? In this video you're gonna find out. My name is Dr. Alexey Markelov. I'm a double board certified plastic surgeon. So let's talk more about lipedema in this video. Today I want to show you the procedure on the patient who is actually an athlete, who's in excellent shape, absolute normal body weight, and someone looking at her legs will say, well, what's wrong with them? They look pretty skinny. However, this patient came to our practice with the complaints of extreme heaviness in her legs, easy bruising. She said even her kids, when they were touching her legs, she experienced a lot of discomfort. She would tell them, listen, don't bump into my legs. So this patient elected early intervention with the liposuction procedure. And as we know, liposuction does not cure lipedema, but it makes symptoms much better. And early intervention can actually be a key to prevent the progression of the lipedema. Today we are doing lower leg liposuction for the patient with the lipedema. She's actually in a great shape, exercises, former volleyball player, and she started to notice heaviness and tenderness in her lower legs, and they also constantly swell up. So the patient was extremely bothered by it, and when she came and saw us, we figured out that she has lipedema. So the condition that's slowly progressing, her legs are a little bit heavier than the overall frame. The treatment option is the lower leg liposuction. So she's awake for the procedure. We completed the first step, which is infiltration of the Tumescent solution. So I'm going to show you how it's done right there, so that you can see using this little cannula, we inject the fluid in the skin, or under the skin actually, in that subcutaneous tissue. So the leg is now infiltrated with that fluid. We used about 1.5 liters, and the solution has lidocaine, epinephrine, and we also add tranexamic acid to minimize the bruising or leakage afterwards. Tiny little 2mm pokes around her ankles and around the knees. Is all numb. She's very comfortable. We're actually talking, and now we're going to proceed with the fat extraction. So this is not a cure for lipedema, but it definitely helps to alleviate the symptoms, helps with the heaviness, with the swelling afterwards. I'm going to use this power-assisted liposuction cannula that's curved, so it's easier for me to get to places. And we're going to start the liposuction part. So you're going to hear the machine that makes noise, suction machine. And we're gently extracting the fat. And you can see the fat coming out. It's hormone-sensitive fat. So the condition gets worse during the pregnancies, teenage years, or after the menopause. It's responsive to estrogen. I know this is hard somewhere. You can see how it's really done. Like we have to stop the procedure. But you can see great difference here between the right and the left leg. The patient will see the difference. Ankles, overall much slimmer, like here versus this. Here versus this. So this much versus this much. Take a peek. You can sit up a little bit. Just don't touch anything. That's a great difference. Good. All right, I'm going to work on your right one now, and then I will turn you, okay? We are finishing up with the patient's left leg, so she's awake, and that's why we can move her, and she can help us with the positioning. The patient's very comfortable. So I'm just doing, again, some evening out. With no suction, we're just making it look smoother. Because that's the most common problem with this procedure, is that the results don't look as smooth as we want them to do. But it's a huge difference with her. She's a skinny girl. She's not by any means overweight, but she's an athlete, and we got 2.2 liters, right? You can show there. 2.2 liters of fat, quite a bit. And when you look at that fat looks pale, looks abnormal. It's very granular. The patient sometimes can feel it through the skin. So we are done with the liposuction. Again, the patient was actually very skinny. 57 kilos. Or what's your weight, Erica? 120 pounds. 120 pounds. So the patient's only 120 pounds. She works out, but you can see this is from her lower legs, just below the knee area. We got 2.3 liters total, and there's only 500 cc's of the actual fluid, that tumescent solution, and the rest of it is the fat. In the state of Florida, we're limited to 2 liters of that fat at a time, because otherwise it can cause major fluid shifts, and the patient will require to stay overnight and get the hydration. But this is a great amount for her 2 legs. I think she's going to feel much lighter. She will see a great difference in her lower leg. Now we're actually squeezing the residual fluid out, so the patient will leak initially There's little incisions around the ankle. We will leak from them for about 24-48 hours. She'll start wearing compression for a total of 4 to 6 weeks. Usually ask for at least 4. That helps to prevent any fluid collections and helps with the skin retraction, even though her skin is of a great quality. End up on your tippy toes. Very difference now. You can see the outline of her tough muscles. And before that, it was all like a cone. But now this is a great difference. Beautiful. You're gonna love it. So here you have it, guys. Liposuction for lipedema treatment in a very skinny patient with relatively skinny legs. I think she's gonna have a beautiful, excellent result, and she'll get a lot of symptom relief from this procedure. I hope you find this video helpful. Click the like button and subscribe below, and I'll see you in the next video.